Vitamins are micronutrients. They are only required in small amounts, but they must be present in the diet. Now, the reason that vitamins are vital is that the body is unable to synthesize vitamins itself. Therefore, they must be taken in as ready formed molecules because human biochemical processes simply can't make them. But the vitamins are vital for human biochemical and physiological processes. So despite the fact that we need these vitamins to run our chemistry and physiology normally, we can't synthesize them ourselves. This is why they are vital to the diet. So remember, the vitamins are micronutrients, only required in small amounts, but nevertheless vital to normal human physiology. Vitamins can be classified as fat-soluble vitamins or water-soluble vitamins. Now, the water-soluble vitamins will dissolve in body fluids in the water component. And because they're water-soluble, this means if they're taken in larger amounts than are required by the body, they can easily be dissolved and excreted in the urine. But at the same time, this also means that they can't be stored long term. So water-soluble vitamins ideally need to be taken on a daily basis because we cannot store them. We need them all the time, so we have to consume them regularly. The fat-soluble vitamins are A, D, E, and K, sometimes described as the ADEC vitamins. And as the name implies, these do not dissolve in water, they dissolve into fats. So they are absorbed through the lining of the small intestine in the chylomicrons. They are absorbed with fats. And the fact that these vitamins are fat soluble has got two main implications. The first is because they're fat soluble means they can be stored in the fatty tissues of the body, particularly they are stored in the liver. So this is good because it means we don't have to eat them every day. We can top up on them and survive in terms of our fat soluble vitamin requirements for weeks or even months on stored fat soluble vitamins. So unlike the water soluble vitamins, we don't need to eat them on a daily basis to maintain good health. But the fact that these vitamins are fat soluble and they're stored in the body also means that we can overdose on them. So it's possible to eat too many fat soluble vitamins. For example, if someone takes a lot of vitamin supplements, you can get a hypervitaminosis, too many fat soluble vitamins that can lead to some potentially dangerous clinical features. And it's interesting, the Inuit peoples, the Eskimo peoples, have always known that polar bear liver is poisonous because polar bears eat fish and they concentrate the fat soluble vitamins in their livers to very high concentrations. And if people eat polar bear livers, they're getting lots and lots of fat soluble vitamins, and that can cause a fat soluble vitamin hypervitaminosis in the people that eat polar bear livers. So best to avoid polar bear liver. Now, vitamin A is present in foods such as liver and dairy products, but it may also be formed from the provitamin beta-carotene. A provitamin is a substance the body is capable of converting into a vitamin. Now, beta-carotene is found in orange or yellow coloured vegetables. So you might think of papaya, peaches, apricots, and carrots. And it's also present in green vegetables as well. Now, you've probably heard that high vitamin A intake in pregnancy can lead to birth defects. And this is true, but it's only a problem if the vitamin A is taken in very high concentrations. And the only food really where you're going to get vitamin A in such high concentrations is liver. So we advise pregnant women not to eat liver and not to take vitamin supplements which contain vitamin A. But during pregnancy And children, in fact, everyone should eat plenty of green vegetables and plenty of orange and yellow coloured vegetables, because the beta carotene is not toxic in its own right. And in fact, the body will only synthesize the amount of beta carotene into vitamin A that is required. So if there's enough vitamin A in the body already, the excess beta carotene will not be converted into vitamin A. So let's advise people to eat lots of fruit and vegetables at all times. Vitamin B1, which is chemically described as thiamine, is found in a wide variety of foods, including pork, duck, whole cereals, grains, nuts, and pulses. And because it's associated with grains, it's actually found in the outer part of the husky part around about the grains of cereal. Then it's often associated with foods which are brown. So brown bread is going to contain much more vitamin B1 than white bread. Brown rice is going to contain more vitamin B1 than white rice will contain. Now, physiologically, vitamin B1 acts as a cofactor for enzymes which are involved in carbohydrate metabolism, so it's involved in generating energy from glucose. And this means that more vitamin B1 is required if people are eating more carbohydrates. But if that carbohydrate is coming from eating brown bread, that's fine, because you'll get the brown bread will provide more carbohydrates, but at the same time, because it contains the outer part of the cereal grain, it's also going to contain more vitamin B1. Deficiency of vitamin B1, that is thiamine, is actually a fairly common vitamin deficiency. In poorer areas of the world where the principal food eaten is white rice, then B1 deficiency may lead to wet or dry beriberi. Now, dry beriberi causes a degeneration of the nervous tissue called a polyneuropathy. And this causes feelings of heaviness and stiffness in the legs, followed by pins and needles with numbness. Later, the trunk and arms and brain are also affected. And actually, we do come across a lot of people who do complain of neurological features. So it's always worth considering if someone's got pain in their legs or tingling in their legs, or are complaining of difficulty moving the legs or walking difficulties. It's always worth considering that there's a possibility that they have a degree of vitamin B1 deficiency. Because this is very easy to correct. We just need to give them more vitamin B1, and we can do that by giving them compound vitamin B tablets. Even if this doesn't turn out to be the cause, then it's a variable which is eminently treatable and very easy to remove. So tragically, there's probably quite a few people going around with deficiency of vitamin B1 in an undiagnosed state, putting up with morbidity that could be easily rectified with a simple course of vitamin B tablets. And it's also true for the functioning of the brain. The brain needs vitamin B to function normally as well. So again, it's a very simple matter to try giving someone some vitamin B. For example, if they're presenting with symptoms of confusion or possible early dementia, the question is it early dementia, or is it simply vitamin B deficiency? Well, if we give a course of vitamin B and the symptoms go away, then that means it was in fact caused by vitamin B deficiency. If we give a course of vitamin B and the clinical features don't go away, then we've lost nothing. So it's worth a try. It's a variable always worth eliminating. Of course, people that are drinking a lot of alcohol may well have a very poor diet. But in addition to this, alcohol will actually impede the absorption and metabolism of thiamine, of vitamin B1. And also, if the person is producing a lot of urine, a lot of vitamin Bs can be excreted in the urine. This is why people that drink a lot of alcohol and alcoholics can often present with B1 deficiency. Now, this can occur this can present as an acute medical emergency called Wernicke's encephalopathy, or it can develop as a long-term complication. If it's a long-term complication, then the type of alcoholic dementia that vitamin B1 deficiency will contribute towards is called Korsakoff's psychosis. This is why when alcoholics are admitted, we tend to give them intravenous injections of vitamin B and C to prevent Wernicke's and hopefully to retard the development of Korsakoff's. And indeed, people that drink a lot anyway should consider taking vitamin B supplements. Not that this will negate the harmful effects of the alcohol, but it might partly negate the thiamine deficiency caused by the alcohol drinking. The chemical name for vitamin B2 is riboflavin, and this vitamin is found in a wide variety of foods, including dairy products, offal, fish, whole grain products, soybeans, green vegetables, bananas. And what riboflavin does is it acts as an enzymic cofactor for several oxidative energy releasing reactions within the cell. So it is necessary for normal energy production in the cells of the body. Deficiency of vitamin B2, that is deficiency of riboflavin, can lead to these fissures at the corner of the mouth, referred to as angular stomatitis. And also there can be inflammation of the tongue, which is glossitis. And sometimes there can be dermatitis, inflammation of the skin of the face. But fortunately, as riboflavin is not broken down by cooking, isolated deficiency is relatively uncommon. But this can occur as part of a general vitamin B deficiency syndrome. So always worth looking out for glossitis and angular stomatitis. And if you see it, consider the possibility of deficiency of vitamin Bs. Vitamin B6 is chemically referred to as pyridoxine. And actually, vitamin B6 includes several closely related compounds. And these are found in a wide variety of foods, including whole grains, nuts, meat, fish, and eggs. And as vitamin B6 acts as a cofactor for enzymes involved with amino acid metabolism, the daily requirement of vitamin B6 increases if the individual eats more proteins. Now, vitamin B6 deficiency can occur as part of a generalized vitamin B deficiency syndrome, and isolated vitamin B6 deficiency is fortunately rare. But B6 is sometimes used therapeutically. It can be used for some drug-induced polyneuropathies. It can be used in sideroblastic anemia, and some people advocate its use in premenstrual tension. Humans are dependent on animal sources to get vitamin B12, that is cobalamin. It's found in milk, eggs, offal, meat, fish, but it's not found in plants. And this means that vegetarians can meet their requirements for milk and eggs, but vegans will eventually become deficient. Now, only small amounts are needed for normal physiology, and the liver can store supplies for a long time, perhaps a year or two if there was a good supply there to begin with and the liver had built up reserves of this vitamin B12. But if someone's on a vegan diet, eventually they're going to become deficient of vitamin B12. Now, most people know that lack of vitamin B12 will lead on to a macrocytic anemia. And the reason we know this is because a lot of older people especially suffer from pernicious anemia, where they can't absorb the vitamin B12 and we have to give them regular injections of vitamin B12, such as thiamine, to treat their pernicious anemia. And most people know about this. But less people know about the subject of the next slide, which is the neurological deficits, which can be caused by lack of vitamin B12, and of course eventually neurological damage. Well, very often we notice that older people don't get around as well as they used to. They can become unsteady on their feet. They're more prone to falls and they have various aches and pains. And sometimes even healthcare professionals attribute this to aging rather than to a specific pathology. But as people get older, very often they can develop a degree of pernicious anemia, and they're not absorbing the vitamin B12 properly because they're not making the intrinsic factor. In this context, vitamin B12 is the extrinsic factor, and the stomach has to produce an intrinsic factor. And it's only when the extrinsic factor, the vitamin B12, combines with the intrinsic factor that it can be absorbed into the systemic circulation. So people can be short of vitamin B12, especially in later life. And this can lead to neurological deficits. So we've already noted that the nervous system needs the other vitamin Bs, and vitamin B12 is certainly also an essential requirement. So initially there can be weakness of the arms, legs and trunk, tingling and numbness that can progressively worsen. And this can be caused by subacute combined degeneration of the spinal cord. So in this picture we see a nice healthy looking spinal cord, but the health of the spinal cord is dependent on vitamin B12. And deficiency of vitamin B12 can lead to these progressive neurological deficiencies. So whenever we have neurological deficiencies, we should always think about the possibility of lack of vitamin B12 or lack of the other vitamin B group vitamins. And sometimes when we treat people who are starting to have walking difficulties or a staggering gait with vitamin B12, they're completely cured and completely reinvigorated and enjoy many years of healthy, active life afterwards. All they need is one thiamine injection every 3 months after an initial recovery bolus period, where we give a little bit more of vitamin B12 to begin with. Folic acid is found in green leafy vegetables, nuts, wholemeal bread, broccoli, and offal such as liver and kidneys. And as with vitamin B12, deficiency of folic acid will lead to anemia with the production of abnormally large erythrocytes, abnormally large red blood cells, a macrocytic anemia. There can also be inflammation of the tongue, which is glossitis. Now, low levels of folic acid can be caused by low intake of folic acid, but it can also be caused by a high intake of alcohol, because alcohol will reduce the absorption of folic acid and also impairs the utilization of folic acid. So perhaps alcoholics and people that drink a lot should take additional folic acid as well as additional vitamins B and C. Of course, it's better not to drink too much in the first place. If mothers have a deficiency of folic acid around the time of conception or during the first 12 weeks of pregnancy, that is in the first trimester of the pregnancy, there's an increased risk of neural tube defects such as spina bifida. So if a woman is trying to get pregnant, or if there's a possibility that a woman will get pregnant, we strongly suggest that they take 0.4 milligrams of folic acid per day and carry on taking that throughout the first trimester of pregnancy. And this will reduce the incidence of these neural tube defects. Like quite a few of the other vitamins, vitamin C acts as a coenzyme, and it's also essential for the formation of the structural protein collagen. This is why vitamin C is so important in wound healing. If patients are deficient in vitamin C, their wounds won't heal properly because they can't synthesize the collagen that's required for normal wound healing. Now, vitamin C is present in all fresh fruit and vegetables, broccoli, potatoes, oranges, tomatoes. But unfortunately, the vitamin C content of food is reduced by cooking. And because it's a water-soluble vitamin, vitamin C will also leach out into the water when vegetables are left in water for a period of time. Deficiency of vitamin C is seen in babies who are fed on boiled milk because the heat will break the vitamin C down. And deficiency of vitamin C is also seen in people with a diet low in fruit and vegetables. And smokers are also at particular risk of vitamin C deficiency because smoking seems to use up the vitamin C more rapidly in the body and probably causes increased excretion of vitamin C as well. So smokers are particularly prone to deficiency of vitamin C. This might not be an overt deficiency, but it will be there perhaps even in a subclinical form, and we should think of that. If there's deficiency of vitamin C, there may be initially weakness and muscle pains. But continued deficiency leads to a syndrome called scurvy. And this presents with features mostly caused by deficient collagen formation. Because as we've noted, vitamin C is essential for normal collagen formation. So wound healing will be impaired and the quality of the skin will be reduced because there's a lot of collagen in the dermis. The cartilage can be affected, as can the forming bones in children, because bone formation comes from cartilage and the collagen is an essential structural component or the essential structural molecule of cartilage and bone. So children that are short of vitamin C, they'll get osteopenia. The bones will become less dense than we would like. There can be reduced formation of dentine, the component in the teeth. And because of the effect on the teeth and the capillaries, the gums can be particularly prone to being damaged. Friable capillaries in the gums can lead to hemorrhage. Collagen loss can make the teeth go loose, and eventually the teeth can just fall out from bleeding gums. So quite a few effects there from the reduced collagen formation caused by the lack of vitamin C. And vitamin C is also antioxidant, so it prevents DNA and small blood vessels from oxidative damage. So another effect on the small blood vessels can be oxidative stress on the vascular endothelium, leading to small vessel compromise and damage. But as well as that, the DNA needs antioxidants to protect the DNA from oxidation. So that can cause damage as well to the DNA itself. And another feature of vitamin C deficiency is anemia. Vitamin C is actually needed for the normal absorption of iron from the gut, and vitamin C is also involved in the hemopoietic process itself. So deficiency of vitamin C can be a cause of anemia. We've noted that we need a certain amount of collagen to support the small blood vessels, and we've also seen that vitamin C acts as an antioxidant, and lack of vitamin C therefore can cause oxidative stress to the vascular endothelium, and this can often be noted in the small blood vessels. So both of these factors mean that hemorrhage is a hallmark feature of scurvy. And actually hemorrhage can occur in any organ, but it's particularly obvious in the skin, and hair follicles are one of the common sites of cutaneous bleeding. So in these pictures here we see perifollicular hemorrhage, that is bleeding around the hair follicles, that's obvious as a form of ecchymosis in the skin. Ecchymosis just means bleeding into the tissues of the skin. And as with any rash caused by the presence of blood in the tissues, if we press on this rash with a glass and look through the wall of the glass, we will notice that the rash does not fade because it's caused by hemorrhage. It won't fade because when you compress the capillaries, because the blood is in the tissue spaces, the blood won't be squeezed out in the capillaries, it'll be left in the tissue spaces, and the rash won't fade. Most of the vitamin D that we use is synthesized in the skin when the skin is exposed to sunlight. But we can also get some vitamin D from the diet in oily fish, eggs and liver. And vitamin D is needed for the absorption and normal metabolism of calcium and phosphorus. Calcium and phosphorus is not much good to the body unless there's enough vitamin D around, because we need the vitamin D to use calcium and phosphorus. And as these elements are essential for bone health, vitamin D deficiency will result in rickets in children, sometimes with abnormally shaped bones that aren't properly formed, and osteomalacia in adults. Osteomalacia means softening of bone caused by deficiency of bone mineralization. Vitamin D is the sunshine vitamin. One of the lipid-based molecules found in the epidermis is called dehydrocholesterol. When this dehydrocholesterol is exposed to sunlight, it's converted into a form of vitamin D. And once this vitamin D has been synthesized in the skin, it is transformed into a much more active form in the kidneys. And actually, most of the vitamin D that our body uses comes from the sunshine rather than coming from the diet. So lack of exposure to sunshine can lead to vitamin D deficiency. Physiologists have recently found out that there's actually vitamin D receptors in lots of different places in the body. And this has probably got quite significant applications. So, for example, it's fairly obvious if children have rickets, we can see the deformed limbs. We can see the widened wrists. But if children have a lesser degree of vitamin D deficiency, what you might almost call a subclinical vitamin D deficiency, then there's some accumulating evidence that this predisposes them to developing type 1 diabetes mellitus. So we might think that a child is not short of vitamin D because they don't have rickets, but a lesser degree of vitamin D deficiency can predispose them to developing type 1 diabetes mellitus, which of course is a very significant disease. And there's also suggestions that lack of vitamin D now can be a factor in multiple sclerosis, because for years we've known that multiple sclerosis is less common near the equator and more common in far north and far southern latitudes. There's also accumulating evidence that vitamin D deficiency can be an etiological factor in cardiovascular disease in adults. And there's also vitamin D receptors in many parts of the immune system. So deficiency of vitamin D could lead to degrees of immunocompromise. So vitamin D seems to be essential for all sorts of normal physiological processes, and lack of vitamin D could well be an etiological factor in many more diseases than we have previously suspected. Why is it that some people have black coloured skin or brown coloured skin and other people have white coloured skin? What is the advantage in being white? Because if you're white, you're very prone to getting sunburn. So what is the biological advantage of white, light coloured skin? Well, the only one I can think of is that you make vitamin D more quickly. So it seems reasonable to assume that vitamin D is very important because entire sectors of the human race have become white purely so they can produce more vitamin D. And this is very important for us to realize as health educators. The darker someone's skin is, the less vitamin D they will make in a particular period of time. So people with dark coloured skin need more exposure to sunlight in order to make enough vitamin D, whereas people with light coloured skin can make vitamin D more quickly. So in the United States, for example, the incidence of cardiovascular disease in black people is about 50% higher than it is in white people, even after you account for other differences such as diet, obesity, hypertension, smoking, and other variables like that. So is it that the extra vitamin D that the white people are making is protecting them against cardiovascular disease? If this is the case, then we should be advising dark-skinned people who aren't exposed to a lot of sunlight to be taking extra vitamin D. We should probably be taking their blood levels of vitamin D and titrating them up to normal levels. So exposure to sunlight, preferably over quite a large surface area of the body, is going to generate essential vitamin D. Now, of course, people have been very worried about children getting malignant melanoma, and we've put out a lot of health messages about this. Kids cook quick, things like that, that indicate that we should keep our children away from the sunshine. And this is true if children get sunburn, they're more prone to developing malignant melanoma. But there again, they need the sunshine to produce the vitamin D. So it's actually the sunburn and excess exposure to the sun which is going to lead to malignant melanoma rather than normal sun exposure. Now, of course, this depends where you live. If you live in northern latitudes like northern England, children can probably be exposed to the sunshine for some time. But if you live in Perth in Australia, where the sun is particularly strong, then they would need to be exposed for much shorter periods of time. So exposure of the skin to sunlight is important to produce vitamin D. That's good. There's a lot of evidence to suggest that we want that, but we don't want the skin to be burnt and we don't want the skin to be damaged, because we know that does predispose to malignant melanoma formation in later life. So it's a matter of assessing the amount of sunshine in your area and allowing our children to have a physiological normal exposure to that sunlight without causing skin damage. Vitamin E is actually a collective name for 8 related compounds. And plant sources provide vitamin E include green leafy vegetables, wheat germ, seed oils, soil, cereal, nuts. And perhaps most of the biological effects of vitamin E result from its antioxidant properties, which aid in the maintenance of the health of all body cells and tissues. And vitamin E also acts to stabilize cell membranes, so adequate amounts are needed to maintain the health of red blood cells. Apparently, if there's a serious deficiency of vitamin E, many red blood cells can become friable and break up, leading to hemolytic anemia. Although I've never seen this, I think it must be very rare. In fact, isolated vitamin E deficiency is not really a recognized clinical syndrome. Vitamin E apparently is also needed for the maintenance of the health of parts of the spinal cord and peripheral nerves, and deficiency can lead to some neurological defects in certain individuals. Vitamin K actually occurs in 2 forms. Vitamin K1 is derived from food sources such as green leafy vegetables, soya, rapeseed, liver. whereas vitamin K2 is synthesized by bacteria living in the colon. So these are symbiotic bacteria. We give them a nice warm place to live and we give them some nutrients, and in return they synthesize vitamin K, which we then absorb and are able to utilize. And vitamin K is absolutely essential because it's used as a cofactor in the liver for the synthesis of several blood clotting factors. This means that if there is a deficiency of vitamin K, there will also be a deficiency in clotting factors, resulting in hemorrhagic complications. So in this nice photograph we see some blood cells all bound together by fibrin strands forming a blood clot. But the formation of the fibrin depends on the existence of several clotting factors in the blood, and we can only make the clotting factors with the vitamin K. So we haven't got the vitamin K, we can't make the blood clots, and therefore we will not have normal hemostasis, and therefore we will have the hemorrhagic complications. Purpura is caused by bleeding under the skin, and because it's actually caused by blood in the tissues, it will not blanch when we press on it with a glass. And this purpura is caused by lack of vitamin K and lack of clotting factors, but it actually looks quite similar to the bleeding caused by the friable capillaries in vitamin C deficiency. So in this case, if we saw purpura, we'd want to consider giving additional vitamin K and giving additional vitamin C, although this one is actually specifically caused by lack of vitamin K, because when you haven't got the vitamin K, you don't make the clotting factors, so the blood does not coagulate as normal, leading to all sorts of potential hemorrhagic complications. But of course, because the skin is on the surface of the body, these things are usually easiest to see in the skin. Minerals are inorganic elements that occur naturally and are essential nutrients. Now, an organic compound contains carbon, whereas an inorganic compound, or an element, a compound of course is a combination of elements. These are compounds and elements that do not contain carbon. Some minerals, such as sodium and potassium, are present in the body in the form of ions dissolved in water. And as ions have an electrical charge, these are described as electrolytes. Other minerals such as iron, iodine, fluoride combine with other elements in the body to form necessary physiological compounds. Potassium is an essential electrolyte. In the form of the K+ ion, it is needed for normal electrical activity in all excitable cells in the body. An excitable cell is a cell which is capable of generating electrical currents across its cell membranes. So these include all nerve cells and all muscle cells. And potassium is the most common positive ion found in intracellular fluid, that is inside the cells. And potassium is found in relatively low concentrations in the extracellular fluid. The extracellular fluid being the blood plasma and the interstitial or the tissue fluids. Now, if the levels of potassium in the blood are too high or too low, or change very rapidly, this is a very dangerous situation because it can cause ventricular fibrillation. The change in the electrolyte levels will alter the electrochemical balance across the cell membranes, making the myocardium so excitable it will go into fibrillation. And this is why clinically we never give bolus intravenous injections of potassium. It's far too dangerous. But as part of a healthy diet, of course, potassium is excellent. It's found in most foods, but particularly in fruit, tea, coffee, And in fried food as well, like chips and crisps, are rich sources of potassium. And plenty of potassium in the diet is very healthy because, amongst other things, good levels of potassium in the diet helps to lower blood pressure. This diagram shows an example of how electrolytes work physiologically in the body. And the cell we're looking at here could be any excitable cell. So it could be a skeletal muscle cell, or a myocardial cell, or a peripheral nerve axon, or a central nervous system neuron, any excitable cell. And when the cell is at rest, it's in a state that is described as polarized. And this means it's negative inside and positive outside. But then when there's a nerve impulse, or in the case of a muscle, when the muscle contracts, the cell will depolarize. And there'll be a movement of ions across the cell membrane, and positive ions will come in, making the inside relatively positive to the outside, which is now relatively negative. And we now say that the cell is depolarized. So it changes from being polarized to being depolarized in this process of depolarization. But then if the muscle wants to contract again, or if we need to have another nerve impulse passing down a particular nerve fiber, that will only happen when it depolarizes. So in order to depolarize again, when it's in a depolarized state, it must first repolarize. And when it repolarizes, it changes from being positive inside to being negative inside again. And now it's undergone this process of repolarization, it's in a polarized state, so it's capable of depolarization once more. And all this depends on the movement of ions, charged atomic particles, going through the cell membranes, accumulating in different concentrations. When it's polarized, there's more negative ions inside and more positive ions outside. When it's depolarized, there's more positive ions inside and more negative ions outside. Iron is primarily essential for the formation of hemoglobin molecules in the red blood cells, and it's also necessary for the formation of myoglobin in the muscles. Now, there are two forms of iron in the diet referred to as heme and non-heme iron. Heme iron is readily absorbed from the gut into the blood and is derived from the hemoglobin and myoglobin found in fish, meat, offal, and especially liver. This is why meat and offal are good for patients with iron deficiency. When the body is short of iron, the gut is able to increase the proportion of absorbed heme iron. And conversely, when less is required, proportionately less is absorbed. Now, the non-heme iron is derived from plant sources such as nuts, beans, peas, green vegetables, grains, and there's also some present in milk. And actually, eggs are quite a good source of iron, come to think of it as well. And this non-heme form is not well absorbed, is not as well absorbed as the heme form of the iron. However, if the non-heme iron is eaten together with vitamin C, much more is absorbed. So if you have vegetable sources of iron and you take vitamin C as well, much more of that iron will be absorbed. Some iron can be stored in the liver, in the spleen, and the bone marrow in the form of a molecule called ferritin. The reason these red cells are red is because they contain hemoglobin, and the hemoglobin molecule is based on iron. And it's also the hemoglobin molecule that carries the oxygen in these biconcaved red blood cells, which are the erythrocytes. And iron deficiency will lead to iron deficiency anemia. The patients can appear pale, and complain of tiredness and shortness of breath, and they're anemic. There is a reduced oxygen carrying capacity of the blood. And globally, iron deficiency is very common as a result of poor diets and as a result of hookworm infections. So very many people in the world are iron deficient. In addition to iron deficiency anemia, iron deficiency can lead to a range of other clinical features. So first of all, if we notice the fingernails on this slide, we can see at the bottom right that the fingernail is of very poor quality and very thin. And we notice in the picture on the top left that it's actually concaved, it's bowing in the way. Nails are supposed to be convexed, of course, they're supposed to bow out of the way. But in iron deficiency anemia, they can become flattened and even concaved, as we see in this picture. At the top right, we notice angular stomatitis, the inflammation at the corner of the mouth, another possible clinical feature of iron deficiency. Now, if we look at the hands at the bottom of the picture, the hand on the bottom left is a normal coloured hand belonging to one individual, and then the hand on the right belongs to another individual who has iron deficiency anemia. Now, the nice red coloured hand, the reason that hand is a good red colour is because lots of red blood is going through the superficial capillaries, giving it that nice red appearance. Whereas in the hand that's a pale colour, because of the reduced amount of iron in the blood, there's reduced amounts of hemoglobin. Because it's the hemoglobin that gives the blood its colour, the whole thing has become pale. And indeed, we might say it's anemic looking. So a good thing to do is when you examine your patient's hands, compare the colour of your own hand with the patient's hand and see if the patient's hand is paler than the colour of your hand. And if it is, suspect iron deficiency anemia, look for the other clinical features, and of course, if necessary, do some hematology blood tests. Severe iodine deficiency will cause a goiter, a swelling of the thyroid gland. And here we see that this chap is getting his thyroid gland examined to see if he has a goiter. And iodine is found in seafood and sea salt primarily. It's also found in vegetables, provided there are adequate amounts of iodine in the soil to begin with. And what we generally find is that iodine comes from the sea, so the further away from the sea that someone lives, the lower the amount of natural iodine in the vegetables that are produced in that area. So traditionally in mountain ranges like Nepal, Switzerland, Derbyshire in England, that are quite a long way from the sea, the amount of iodine is low, and iodine deficiency has been a traditional problem. These days, with modern diets and transporting seafood, it's usually not so much of an issue. But we need the iodine to make the thyroid hormone. Without that, we simply can't make it. Calcium is an essential component of bones and teeth, and it also functions as an electrolyte in the form of the Ca2+ ion. The absorption and utilization of calcium requires the presence of vitamin D. So calcium and vitamin D go together physiologically. The calcium cannot be functional and cannot be absorbed without the presence of vitamin D. Deficiency of calcium or vitamin D in children will lead to rickets. In this disorder, there is deficient ossification of growing bones, leading to softening and bending of the long weight-bearing bones. Severe calcium deficiency can also lead to a condition called tetany, which describes increased muscle excitability because the calcium ions are necessary for normal muscle activity. In tetany, even mild stimuli may cause skeletal muscles to spasm, generating cramps. So this child was short of calcium and vitamin D. This has led to softening and bending of the long weight-bearing bones, giving rise to this classic bow-legged appearance. And of course we need to restore calcium and vitamin D to the child's diet as soon as we suspect that this may be developing. This X-ray shows why it's important to give young children adequate amounts of fluoride when they have their primary dentition, when they have their milk teeth. So if you look at this X-ray, you can see the layer of milk teeth in the middle, but then you can see the secondary dentition in pre-erupted form when the teeth are not erupted. So I think you can see the bottom teeth and the top teeth waiting to erupt. And this secondary dentition, when it's forming before it's erupted, needs adequate amounts of fluoride as it's forming. If this child gets adequate amounts of fluoride when the secondary dentition is forming, before it's erupted, while the child still has their milk teeth, then their adult teeth, their secondary dentition, are going to be more healthy for the rest of their adult lives. Fluoride is necessary for healthy teeth. If there's no fluoride in the water supply in certain areas, dental caries become much more likely. Sea fish and tea also contain some fluoride, but for most people it's found in the water supply. Children given adequate amounts of fluoride in early childhood, when their teeth are developing, enjoy significant resistance to tooth decay. So in many areas, for many individuals, it's reasonable to say that dental caries are a clinical feature of fluoride deficiency disease.